Subscribe to our YouTube channel to learn surgery in simple way.
Cryptorchidism. What is testicular descent? In fetus, testes develops in retroperitoneum near kidney. It takes its arterial supply, venous drainage from nearby aorta and IVC, lymphatics drain into nearby nodes below renal hilum, making them regional nodes. So, nerve supply is also from same area. As fetus develops, testes starts its journey downwards towards scrotum. This results in elongation of artery, vein, lymphatic vessels and nerves. This descent is aided by a soft tissue called gubernaculum, which goes ahead of testes and enlarges, thereby enlarging inguinal canal and paving way for testes. It checks wandering of testes from its path and ensures complete descent. What is cryptorchidism? Cryptorchidism means hidden testes. It means testes is not palpable in scrotum. It can be due to undescended testes in which descent of testes is stopped due to some reason leading to testes lying anywhere along its path. Superficial inguinal ring, deep inguinal ring, inguinal canal, proximal to deep ring, near iliac vessels or higher up near kidney. Another reason for cryptorchidism is testes straying away from usual path, leading to testes lying in position away from normal path of descent, like superficial inguinal pouch, which is superficial to external oblique, femoral triangle, near pubis. These are called ectopic testes. Can cryptorchid testes be palpated? Cryptorchid testes may be palpable in 70 to 80% cases, when they are at or distal to deep inguinal ring. In 20% testes lies proximal to deep ring and is non-palpable, plus undescended testes due to higher surrounding temperature undergoes atrophy, which shrinks its size. What causes testicular descent? Two hormones responsible for testicular descent are testosterone and insulin. Like 3. How do you find non-palpable testes? Ultrasound, MRI and diagnostic laparoscopy are done in order to find testes. If diagnosis is made right after birth, 6 months observation can be done. Sometimes testes descends late after birth. Earlier practice of giving hormone injections to babies to promote descent is not used nowadays. What are the risks of non-descent? Testes are anchored in scrotum by attachments like gubernaculum. An undescended testes lies freely in its proposed pathway with little attachment. Hence undescended testes are prone to torsion and gangrene. This can present as acute abdomen. Such testes undergoes atrophy and becomes smaller with germ cell function decreases. Leydig cells are relatively resistant to higher temperature and androgen production is affected late. That is why bilateral undescended testes patients may still have secondary sexual characteristics well developed. Undescended testes are prone to develop malignancy, especially seminoma. Torsion may lead to complete necrosis. What is treatment of undescended testes? Treatment of undescended testes is to find it and bring testes down to scrotum and fix it there. This is called orchiopexy. Ideally it should be done before 18 months of age. Even orchiopexy at early age does not completely eliminates risk of malignancy. In patients presenting later, orchiopexy is done not to recover function, but to make testes easily palpable so that any tumor, if developed, can be diagnosed at early stage. Along with descending testes, there is a protrusion of peritoneum along with it called processus vaginalis, which obliterates after descent, except around testes forming tunica vaginalis. In case of non-descent, processus vaginalis remains patent, hence may lead to descent of bowel in it causing inguinal hernia. How is testes with short pedicle brought up to scrotum? In order to bring testes down, its pedicle must be elongated. There are several ways to do it. Cord is dissected and freed of its attachments. Cremasteric muscle is divided to release its hold on cord. This causes elongation of cord. In many cases, especially when testes is in inguinal canal, cord is lengthened sufficiently to bring it down to testes without tension. If still not possible, inferior epigastric vessels are ligated and cord is brought medially leading to a straighter, shorter route to scrotum. Retroperitoneal adhesions of the testicular vessels may be released to free vessels for medialization. These steps are done via inguinal route. However, if testes is palpated in inguinal canal or near ring and it can be brought into scrotum by pushing, then scrotal incision is given and testes is fixed in scrotum. This is scrotal orchiopexy and is feasible only when testes can be pushed in scrotum. How is testes retained in scrotum? Cremasteric muscle is already divided which can pull testes up. Testes is kept in a subcutaneous pouch superficial to dartus muscle, also called subdartus pouch.
Subscribe to our YouTube channel to learn surgery in simple way.